Introduction. Living with chronic obstructive pulmonary disease, COPD, presents unique challenges, as it progressively affects lung function and makes daily tasks more difficult. COPD encompasses conditions like chronic bronchitis and emphysema, both of which obstruct airflow and cause chronic respiratory symptoms. While there is no cure for COPD, careful management of the condition can help you breathe easier, reduce flare-ups, and improve your quality of life. This guide is designed to provide a comprehensive approach to living with COPD, focusing on practical tips for breathing techniques, staying active, managing medications, creating a healthier home environment, and tracking symptoms. Whether you've recently been diagnosed or have been managing COPD for years, these strategies can help you regain control and lead a more comfortable, active life. Understanding COPD and identifying your triggers. COPD obstructs airflow and makes breathing more difficult by causing inflammation in the airways and damage to the alveoli, air sacs, in the lungs. It's crucial to understand your specific type of COPD, whether it's more focused on chronic bronchitis or emphysema, as different types may require slightly different management techniques. Common symptoms include persistent coughing, mucus production, wheezing, and shortness of breath. Identifying triggers. Every person with COPD may have different triggers that exacerbate their symptoms. Tobacco smoke, air pollution, cold weather, allergens, and even respiratory infections can lead to a worsening of symptoms. Tip: keep a journal to track your daily symptoms and pinpoint which triggers lead to flare-ups. Avoid environments with poor air quality, secondhand smoke, and strong scents that might aggravate your condition. Mastering breathing techniques. Proper breathing techniques can help you conserve energy, reduce shortness of breath, and improve lung function over time. By practicing specific methods regularly, you can manage COPD symptoms more effectively. Pursed lip breathing. This technique helps slow down your breathing, preventing breathlessness. It also keeps your airways open longer, which improves air exchange in the lungs. How to do it: inhale slowly through your nose for 2 seconds, then exhale through pursed lips, like you're blowing out a candle, for 4 to 6 seconds. Practice this method during times of activity or when you feel breathless. Diaphragmatic breathing. Also known as belly breathing, this technique encourages the use of your diaphragm, a key breathing muscle, to take deeper breaths. How to do it: place one hand on your chest and the other on your abdomen. As you breathe in through your nose, allow your abdomen to rise while keeping your chest still. Exhale slowly through pursed lips and focus on letting your abdomen fall. Practice for 5 to 10 minutes a day. Incorporating regular exercise. Physical activity is crucial for maintaining muscle strength and improving overall lung function, even with COPD. Regular exercise can increase your endurance and make everyday tasks less tiring. Exercise tips for COPD. Walking. Start with short walks and gradually increase the duration. Walking at a steady pace strengthens your muscles and helps condition your lungs. Strength training. Incorporate light resistance training to build muscle strength, which can make breathing easier over time. Use light weights or resistance bands. Stretching. Incorporate flexibility exercises like yoga or simple stretches to improve posture and reduce tension, which helps with easier breathing. Pulmonary rehabilitation. If available, consider joining a pulmonary rehabilitation program. These specialized programs teach COPD patients how to exercise safely, manage symptoms, and maintain a positive mindset. Medication and oxygen management. Medication is a critical aspect of COPD management. Most people with COPD will use a combination of bronchodilators to relax airway muscles, and inhaled corticosteroids to reduce inflammation. It's important to understand how and when to use your medication. Inhalers. Ensure you know how to properly use your inhaler to get the full dose. Nebulizers. For those who require more frequent or higher doses of medication, a nebulizer might be recommended. Oxygen therapy. If your oxygen levels are too low, your doctor may prescribe supplemental oxygen. Always follow your prescribed oxygen therapy plan and use it during physical activities to prevent breathlessness. Tip: create a medication schedule and set reminders to take your meds on time. Missing doses can lead to flare-ups or worsening of symptoms. Optimizing your home environment. Your home can play a huge role in your comfort and breathing ability. Making small adjustments can greatly reduce your exposure to irritants and improve air quality. Use air purifiers. Invest in a high-quality air purifier with a HEPA filter to trap dust, allergens, and pollutants. Ventilate your home. Ensure proper ventilation to reduce humidity and prevent mold or mildew. Open windows for fresh air circulation when air quality outside is good. Avoid strong scents. Reduce the use of perfumes, cleaning products with strong chemicals, and air fresheners. Choose natural or hypoallergenic products when possible. Tip: monitor your local air quality index daily and avoid outdoor activity on days when pollution or allergens are high. Hydration and balanced nutrition. Staying hydrated is key to thinning mucus, making it easier to clear from your airways. Drink at least 6 to 8 glasses of water daily, unless your doctor advises otherwise. Nutrition tips. Focus on a balanced diet that includes lean proteins, fruits, vegetables, and whole grains. Avoid large meals, which can make breathing more difficult due to pressure on your diaphragm. Avoid foods that can cause bloating, like carbonated drinks and fried foods. Creating a COPD action plan. Work with your healthcare provider to develop an action plan for managing flare-ups or worsening symptoms. This plan should outline when to seek medical attention and what steps to take during a COPD exacerbation. Conclusion: COPD is a lifelong condition, but with the right strategies, you can take control of your breathing and live a fulfilling, active life. By incorporating breathing techniques, staying physically active, managing medications, and optimizing your living environment, you can reduce symptoms and improve lung function. Consistency is key, so make these tips a part of your daily routine. Remember, working closely with your healthcare provider and having a solid COPD action plan can help you prevent flare-ups and maintain stability. Be proactive, and take charge of your COPD management to enjoy a better quality of life. Check my links below for more helpful resources on managing COPD. Don't forget to like, comment, and consider subscribing for more health tips and tutorials. Thanks for watching CyberTheo.